Hi, my name is Dr. Peter Jurcevic. I'm an obstetrician and gynaecologist, and I have 26 years of expertise. And I have special interest in both high-risk obstetrics but also in the natural aspects of the birthing process. It's my pleasure to provide you with advice and care. I'd like to talk to you about birth preparation. First question I ask my patients when we talk about their birth choices is, what sort of birth would you like to have, and do you understand the birth process? For most women who are looking at having a normal birth, what they are implying is that they would like to push their baby out themselves, they would like to do so without any unnecessary pain relief, and they'd like to do so with minimal or no trauma, no tearing. The perfect birth. The first thing I do is explain to them some of the statistics behind having a baby. In about 35% of cases when a woman attempts a vaginal delivery, she will end up with a caesarean section. There can be different reasons for this, and these can include things such as the baby becoming distressed or the baby not fitting down through the birth canal. In about 15% of cases, a woman will need to have my help using the forceps or the vacuum to assist the baby out, either because she's having trouble completing the delivery, pushing herself, or again if the baby's becoming distressed very late in the birth process. What I remind women is the baby will usually send me cues and signals, and there'll be things on examination that I'll be able to use to determine whether you'll need to have these different modes of delivery. In about 40% of cases, a woman will need to have an epidural for pain relief. There is no shame in having an epidural. Epidurals are because the pain of labour can be quite overwhelming, and for some women they simply are unable to manage otherwise. Epidurals are fantastic, as you will in virtually all situations have no pain. However, epidurals can have consequences, and we know that in about 50% of cases, if you have an epidural, it can affect the birth outcome because of changes in your physiology. So for example, when the epidural is in, your blood pressure may drop. This may drop the baby's blood pressure, and that may affect the baby's health status. It may make it very difficult to push because you don't have any sensory feedback, in which case I might need to help you to pull the baby out. And then there are cases where when you have the epidural, you may find that your contraction quality will change, and I might need to use medication to help to improve those contractions for you. All of these things can be fixed, but unfortunately there can be consequences to the overall outcome. In about 90% of cases when you deliver a baby vaginally, you will sustain a tear. We grade tears from 1st degree all the way up to 4th degree. 3rd and 4th degree tears are tears that we desperately hope to avoid for you. 1st and 2nd degree tears are fairly common, and there are ways of trying to minimise the chances of tearing. One of these ways is doing perineal massage, although it is quite difficult to do and its statistical validity is borderline. There is a product called the Hypno, produced by Starnberg Medical, which is a special device you can use in the last month of the pregnancy. By using this specialised device under guidance, and I'd be certainly happy to advise you on how to, you can reduce your tear rates by approximately 30%. And I've been known to be able to do a number of assisted deliveries using the forceps or the vacuum without having to cut an episiotomy, which can be quite painful afterwards. So essentially it's really important to be aware of these statistics so you understand that trying to have a completely normal birth requires a few hurdles to get through. Because pain relief can be so tricky, one of the things that I talk to women about is about calm birthing. Calm birthing and hypnobirthing is a specialised process where you learn meditative breathing techniques which can help to provide you with ways of managing pain without the need to use medication. There are the options of hopping into the bath or the shower, as water therapy can be very effective for pain management. And there is also a device called a TENS where you can place little electrodes on your back, and a very low voltage current can be used to help to try to trick your nerve fibres in your back, which can help to reduce the pain that you're experiencing with your contractions. These natural approaches can be very effective in helping to minimise your pain requirements. If this doesn't work, we are able to give you a dose of morphine, which is safe for the baby. And if it turns out that you are going through all of these different options and are still in need of any extra support, there is of course an epidural, and as I mentioned earlier, there's no shame in having this.